All right, perfect. And I will now begin my presentation. Give me just one sec. All right, there you go. I have that set up. All right. Can you guys see my screen? Or can you guys see the presentation? Can somebody just unmute and let me know, and then I will begin the presentation.
Yes, doctor, we can see.
You can see the first slide that says professional dilemmas, right?
Yes, professional dilemmas. Yeah,
All right,
doctor.
all right, perfect. All right, Sachin. So let's begin. All right, so as you guys are aware, the MSRA exam, the next session is going to be in September, which leaves you guys with roughly May, June, July, August, so 4.5 months to prepare for the exam. Probably 5 months, maybe depending on when the exam is. Usually it's in the beginning of September, so let's just keep it at 4.5 months. Now, I would personally recommend that this is the right time for you guys to really start preparing for this exam seriously, especially the professional dilemmas part. Now, the clinical problem solving part, you guys can really get done with that preparation for that in 3 months, 3.5 months. But it's really the professional dilemmas portion, and think of it like the IELTS exam or the OET exam. It really depends on your background knowledge and your attributes and how you're, or for example, for the English OET or IELTS exam, your background English and how you're able to, utilize that at the time of the exam. So the professional dilemmas isn't really a knowledge exam. It's about testing a set of attributes that you do possess and how you apply them when presented with particular situations that you could probably encounter in the exam and in real life as well. And then based on how you answer those questions. So the only thing that is needed for this exam is practice, 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 and practice that is spread out over a period of time so that you're really able to internalize all of those attributes. So with that, let's just dive in. Now, the professional dilemmas portion of the MSRA functions as a situational judgment test. It basically assesses your approach to uh, responding to dilemmas in the workplace. And unlike the CPS exam, it is not a test of knowledge, like I said, but it checks for specific attributes. And it's very similar to an exam that UK graduates sit after their MBBS degree or the MBCHB degree before they start their foundation training, which is called the house job or the internship in our part of the world. Most importantly, you have to keep in mind that there is no negative marking in this portion of the exam. So you have to answer each and every question. If you do not, you will miss out on vital marks. Now, this exam is set in the context of a foundation program. So there's 2 years of the foundation program in the UK. And so every question is going to require you to assume that you're a foundation year 2 doctor. And that is how it is going to start out with the question or the situation before it gives you the answer choices. And it reflects a wide spectrum of rotations which are experienced by foundation year 2 doctors in the UK. So it could be like a GP practice, it could be a stroke unit, it could be the acute medical ward. And then you have to be able to think along those lines in terms of the practice setting and then answer. Now, the question paper, the professional dilemmas is usually the first section in the exam. So when you go and sit in at the Pearson VUE venue, the administration at the venue is going to log you in. And then once you go through the intro screens, your timing will start. The first portion is going to be a professional dilemmas paper. Then you have a 5-minute break, and then you go on to the CPS section. The professional dilemmas paper consists of 50 questions with a time limit of 95 minutes, which brings you to a total of 1 minute and 53 seconds for each of these questions. Now, I cannot emphasize enough how important it is for you guys to initially start practice, but once you get into the hang of doing questions on a routine basis, to do them in a timed manner, because really most of the candidates that I've come across in real life or on forums online, one of the biggest challenges that they have faced is that they spend too much time at the initial questions, because of which they weren't able to pace themselves properly, and they left out with, so they were either randomly kicking answers in the last 5 or 10 questions and losing out on vital marks like that. I myself, so my in the February exam, my clinical problem solving in terms of timing, in terms of knowing the answers, it went really well. But in the situational judgment part, for the last 2 or 3 questions, I was really spending a lot less time than I should be on each question. And so I cannot emphasize enough that how important time practice is for this portion of the exam. Now, the stems for these questions, as compared to the clinical problem solving questions, can be very wordy. And a lot of times the choices are very similar. So you have to train your mind to be able to respond to each of these questions within the time frame given. You have to train your mind while doing practice questions not to get too bogged down into getting all of your answers flawlessly, because once you've got the basics down, practice is really the thing that is going to help you adjust your timing in a manner where you're able to reproduce that sort of practice in a time manner in the exam. Now, there's two sorts of questions in the professional dilemmas paper. There's the ranking questions, which generally, which are at the first part, which are the first portion, and you generally half of the exam. And then there are the MCQ portions. Now, in experience and in general, the ranking questions generally take more time. So you might get off thinking, okay, if half of the questions are ranking and half are MCQs, I should spend half of the time on the ranking questions and half of the time on the MCQ questions. That is really not the case. You will find that you're able to do the MCQs questions in a slightly shorter time frame. But in the next window, I will be sharing like time targets that you have to keep in mind when you're answering your practice mocks, as well as in the actual exam. I will be sharing this slide along with a link to the YouTube video YouTube channel and the video when I upload this online as well. So, you don't have to take notes, just focus on, understanding everything that I'm going through. I will share all of these resources in the group as well. All right, so timing. When you sit the exam, there's a timer at the top, which is counting down to, how many minutes you have left for the exam. At 22 minutes, you should be doing, and this is exactly really the key that I used in my exam as well, where at 22 minutes, I made sure that I was done with 12 questions. And then at 44 minutes, I was making sure I was done with 24 questions, and similarly 66, 36. So when you end up, when you're at that stage of your practice where you're doing time mocks, this particular key, forget about the 1 minute 53 questions, because you can't really pace yourself. You'll be wasting time just looking at the clock if you pace yourself with every minute. So these are really important, time markers that you can keep in mind. Okay, it's been 22 minutes. Have I done 12 questions? It's been 66 minutes. Have I done 36 questions out of the total 50? All right, so tips that apply to both sections, the ranking questions as well as the MCQ questions in the professional dilemmas section. Number one, there is no negative marking. So you have to make sure that you do attempt each and every question. Most candidates, the issue they have is they want to do the initial questions flawlessly, and because of that, they miss out on the marks. Even though if their answers were less than optimal in the initial ranking questions, but they were able to do the MCQ questions or at least complete all of the question bank, they will probably end up scoring a lot higher if they ended, for instance, did the initial questions flawlessly, but then sped through the remaining questions. So make sure that you do all of the questions, because there is no negative marking. Now, you have, when answering the questions, you have to keep the 3 GMC target domains at the front, and I will be talking about each of these domains in detail in the subsequent slides, but they sound very cliche, but these are really the basis of the marking standards. So a professional attitude, coping with pressure, integrity, empathy. These are the things, and I'll be talking about each of these target domains in the subsequent slides as well. Now, the number one tip that I can give you for this exam, and this is really, I think, the key for answering each of the uh, ranking questions as well as the MCQ questions, identify the problem. So this is how I identified, the problem with my approach in answering these questions is I would read through the question stem and then I would immediately jump to the answer choices. And between looking at timing myself, deciding the options, looking at the question again back and forth, it would waste a lot of valuable time. So you have to ensure that you clearly identify the issue or issues in each scenario. You have to make sure that you think about every person or party that has been mentioned in the stem, and then you have to take the action or combined action that basically most completely resolves every issue for every person. So whether it's a patient, their relatives, your colleagues, nurses. So what you do is, and here's really the key trick in answering the professional dilemmas, you read the question stem, take a 5 seconds or 10 seconds and think, okay, so the stem has me as one person, my colleague as the other person, and the nurse as the third person. And the issues are this, this, and this. If you just say that in your mind and then you start reading the answering questions, you will realize that, okay, some of the options sound absolutely appropriate, but the only issue with them is that they're not resolving every issue for every person. Hence, they have a lower rank than those that are that have the right wording as well as resolving every issue in a timely manner. So if you're able to practice this where you read the question stem and then you identify the people involved and the issues involved, these are really the key things. So if you identify, okay, this person, so me, patient's relative, patient, these are the three people in this question, for example. And then issue is with confidentiality, daughter's concerns. And so if you able to identify the people, identify the issues, you're good to go. Then you read the options and select or rank them appropriately. Now let's talk a bit about the target domains that I've measured. There are basically three target domains that the professional dilemmas paper is assessing you on, which are professional integrity, which basically just means you have to be honest in your work, coping with pressure, and the third is empathy and sensitivity. So if you have to show honesty when picking between choices, you have to show that you're able to handle pressure in a healthy manner, that is. And you have to show empathy and sensitivity to your colleagues, to yourself actually as well, to your colleagues and patients and their relatives. Now, when you're answering, the reason why target domains are important is because when you're answering, you will realize that if an option which covers most of these will rank highly, or an option which completely excludes or at least one of these or doesn't cover all of these will probably end up ranking lower in the options or will not be selected. So professional integrity really just means you have to be honest, you have to be able to admit or own up to your mistakes. So let's say if you have a prescribing error in a patient's, what do you call it, management, you have to be able to admit that mistake to the patient or your consultant. You have to be respectful, you have to be able to maintain boundaries, you have to know where ethical conflicts arise and how to handle them. You have to be proactive and not pass the buck to other people. You have to be dedicated to providing equal care to all patients and always act in the best interest of the patient. So the number one priority in choosing any course of action has to be the patient. Patients will always come first, unless it's and even if it's a choice where you have to compromise on something that concerns you directly, if it's the reason why that might come up first, where you will be prioritizing your interest, is not because you're prioritizing yourself, but because you prioritizing yourself will end up prioritizing or ensuring patient safety. So essentially, you're prioritizing patient safety and patient's best interest in all domains. So, guys, a quick what do you call it announcement about the structure of today's webinar. I will be talking about the tips and tricks for each of the sections, and then at the end of this section, I've actually kept a couple of practice questions for each of these, the ranking questions as well as the multiple choice questions. And so we'll see how the tips that I've talked about, how they apply. And the whole point of giving this presentation is to run you through the mental process that you should be carrying out when answering the professional dilemmas section of the exam, and then apply that in these practice questions and in the subsequent, what do you call it, uh, practice that you do on your own as well for the exam. All right, so coping with pressure really just means, you have to be emotionally intelligent. You have to know where your competence lies, when to seek help. So any question where any answer choice where you're shouting at another colleague, or you're raising your volume, or another colleague is raising another volume, ranks lower down, or that is behavior that needs to be confronted, even if it's your consultant doing that. You have to show flexibility and resilience. And then lastly, but definitely very importantly, empathy and sensitivity. You have to be empathetic to yourself, to your patients, to your colleagues. You have to be able to empower patients to make decisions. You have to be able to explore patients' wishes and concerns, their relatives' wishes and concerns. And your answers should be very patient-centered, primarily when choosing the order of priorities in the answers. Now, coming to the item types and formats, there are 50 questions, roughly half are ranking questions, half are MCQs. There's no negative marking. All professional LMS questions begin with a stem in which some sort of issue has occurred, and then you're given a set of responses to choose from in order to best resolve the issue. And then, so let's start with ranking questions and what the ranking questions are. Then I'll be talking about the tips you use. Then we will talk about the multiple choice questions and the tips you can use. And eventually, at the end of this session, we will be doing a couple of practice questions for each so that you can get an idea of how I'm using the logic and the tips in each of these. Now, if you guys have any questions, I'd encourage you to write them down in the notes alongside. I'm going to go through the presentation. Unless it's a burning question that you feel has to be answered, then you can unmute yourself and ask. But if it's a question that you think can wait till the end, you can write in the chat. And so once I'm done with the presentation, I will go through the entire chat one by one, and then I'll answer those questions accordingly. All right, so ranking questions. The question will basically give you a stem or a scenario, and then it'll tell you rank these in order of the following action, rank in order the following actions in response to this scenario. There can be 4 or 5 choices. Number 1 will be the most appropriate choice that you rank, and number 5 will be the least appropriate. And really, so in the actual exam, what do you call it, interface, you will have a space, and then you will have the options given on the side. So you read the question, and then you drag and drop each of these in the order. And so if you so you can actually drag and drop them one by one, or so let's say if you drag and drop an option at position 1, then you drag and drop an option at position 2, but then you realize, oh, you know what, there's another option lying outside that I want to be at position 2. You can drag and drop it in number 2. The number 2 original drop that you put over there is going to just go back to the screen. So basically, you have to drag and drop them in the actual exam. And for the MCQs exams, it's really just 8 options, and you have to tick the correct options, and that's pretty much it. So you will be asked to rank the appropriateness of the 4 or 5 actions according to which most effectively resolve the issues within the STEM. Now, this is another key point. You have to remember that each answer has to be treated as an independent, discrete action. This is poles apart from the MCQ question, where you have to answer the questions combined or in action. So the 5 options that are given, or the 4 options in the ranking questions, are not taken combined. So you don't say, okay, I will be doing this and this and this and this and this. No, you have to keep the word or in the ranking questions. The key word to use is or. Okay, so you read the question, you read the options, you go like, okay, I'm gonna do, let me read the options. This sounds like the most appropriate option. So the number 1 option, if I can do this, I'm gonna do this. Or if I can't do number 1, well, let me read the remaining options. Okay, number 2 option, if I can't do number 1, or is this, it's not as good as number 1, but it's almost as good, or at least, not as bad as the remaining 3. So you put that. Okay, now you've done number 2. If you can't do 1 and 2, or what's the next option? So you can do number 1 or number 2 or number 3. So the key word here to remember is the word or, because these are independent, discrete actions. They're not chronological actions that you have, and they have to be taken on their own merit. So now the order that you give in the ranking question is basically compared to a predetermined key. More marks are awarded for answers that are ranked in a similar position to where they fall in the key determined by the examiner. So I'm going to share the key in the next slide as well. So if you have the same order as the exact, what do you call it? So if you rank something as number one and the examiner ranked it as number one, you get 4 marks. And so if you rank number two as number two, you get 4 marks. So for options for questions that have four, what do you call it, options, if you rank it absolutely perfectly, you'll get a total of 16 marks. And for options that you that have five, if you rank absolutely everything correctly, you'll get 20 marks. Now you have to make sure that, you have to keep this back in the back of your mind, that your entire score for the professional dilemmas portion is basically combined and then put on a what do you call it, a relative ranking scale, where 250 is the mean, and then based on where your total score lay in comparison to all of the other people that took the exam in that setting, is where the score that you get for your professional dilemma section in the final exam. All right, so how are ranking questions scored? This way. So let's say an ideal rank was, what do you call it, was in a, let's say this is an examiner key. So there was, the options were A, B, C, D, and E, and you ranked D, and the key was D, C, E, A, B. And now if you rank D as number, this is the examiner key, D, C, E, A, B. So if you rank D at number one, like just like the examiner, you get 4. If you rank C at number 2, you get 4. If you rank E at number 3, you get 4. And similarly, if you rank A at number 4, or you get 4, and then B at number 5, you got 4, for a total of 20. Now, every portion that you so every step that you're away from the examiner key, you lose 1 point. So let's say if you ranked D not as number one but number two, so you're one position away from number one, you lose 1 mark. So you don't get 4, you get 3. Similar, if you're 2 positions away, you get 2. If you're 3 positions away, you get 1 for that particular option, or 0. And so similarly, you can just when I share the slide, you can look at this particular ranking questions and understand really the key. And this will really tell you that the whole point of sharing is not to just get you bogged down in the details. Or it's about telling you that, even if your rank isn't perfect, the closer you are to the examiner's key, the more marks you get. But even if you're further away, you're getting at least some score. So choose your options within the time frame. You don't have to be perfect. And practice will teach you how to do them in a time manner, and then move on. Because answering all of the questions is more important than getting them perfect, because you're getting some score for every combination that you get. So even if, let's say, you ranked it, which is really, if with some practice won't be the case, but let's say your key is absolutely wrong, so you're still going to end up getting at least some marks, which is going to be 8 scores. So let's say you were here, and the least score you could get for this is 0. The least you could get for this is 1. The least you could get for this is 2. The least you could get for this is 1. So 1, 2, 3, 4, and that's 0. The minimum marks you can get, even if you get all of the rankings correct, is 4 marks, which is still something. So and which is very highly unlikely going to be the case. So you don't have to be perfect. Practice, answer questions, move on, because doing all of the questions is important. Now, one of the most effective way to prepare for the MSRA is to review the rationale. So when you're doing practice questions, whether you're doing that from the Oxford Assess and Progress book, or if you're doing them from the what do you call it, the revised MSRA question bank, or any other question bank, really, you need to review the rationale, at least initially, but highly recommended that you do it for every question that you answer. Why? Because it gives you the justification of why each option is the correct option, or why, what do you call it, one option ranks lower, or why in one of the MCQ options, this isn't really the correct option and this is the correct option. Now, what happens when you read the rationale is you start noticing patterns in the answer. So let's say initially you are going to get a lot of your questions incorrect. That's okay. Do not get discouraged by that. Because why? Because if you keep on doing questions, if you keep on reading the rationale, you're going to keep on internalizing the logic, and you will realize that, oh, a lot of these questions, they end up presenting with similar situations. So it's a different setting, but the question is going to be either about, a colleague who's under pressure, or you're under pressure, or a colleague who's getting disturbed by the allied health professionals, or it's you're getting disturbed by the allied health professional, or it's a confidentiality issue for you, or it's a confidentiality issue for your colleague. So there's really a lot of running themes in these questions. So the more practice questions you do, you will realize, okay, this is really the logic that applies in this setting. But you have to be careful, because if you can't really reproduce that logic, you need to be able to read the stem and tweak the logic accordingly, so that but you will identify running themes, and you will realize, okay, you know what, in this scenario, this is what needs to happen, and in this scenario, this is what needs to happen. So really the key is practice. So, and you will also start recognizing buzzwords, and I'll be sharing some of these buzzwords later in this presentation as well. Some of these are going to be good buzzwords, some of these are going to be bad buzzwords. So good buzzwords, the rank goes up, or that option gets selected in the MCQ. Bad buzzwords, the rank comes down, or that option doesn't get selected in the MCQ. So once you get an understanding of these rules, it'll become a lot easier for you to justify, why some things are appropriate and why some things are inappropriate. So give me just one sec. Let me take a quick water break, and then we're gonna kick off the ranking tips. Any questions so far, guys? You can probably just unmute yourself. Let me just see. All right, no questions in the chat. We do have 7 participants though, so perfect. Let me just reshare my screen. What am I doing here? All right, there you go. All right, so one more thing, guys. So there's only really, I think it's going to take a lot longer than I thought it was. There's 7 minutes left to the meeting, but rejoin using the same link when the meeting time runs out, okay? I will pick up exactly where I'm leaving off from when this meeting ends. In fact, yeah, I'll just give you guys a disclaimer that, the meeting's about to end, and then just rejoin with the same group, and then we just pick up where we left off from. All right, so kick off the ranking tips. Number 1, when you're ranking options, whether it's 4 options or 5 options, you have to start with the outliers. You will read the scenario. After reading the scenario, what do? You don't go to the options first. You have to recognize the people given in those in the situation, and you have to realize the issues that are arising in the situation. Once you have the recognition and repeat that in your mind, okay, you know what, it concerns me, these are the issues, then you look at the options. Now, the first thing that you should do in the ranking options is recognize which is the best action and which is the worst action. And really, with a bit of practice, this comes very easily. And if you're able to pick out those, that's half the game already won. Because if you're able to put the best option in the best position and the worst option in the worst position, you will realize, and if you look at the scoring key, even if you shuffle the options in the middle, you won't be losing as many scores as if you put the worst option somewhere else, or if you put the best option somewhere else. So number 1, start with the outliers. You need recognize which is the best option given in the ranking questions, which is the worst action. And once you've done these, you can figure out the middle options in the middle a lot more easily. So what you recognize the best, put it up there. You recognize the worst, put it at number 4 or number 5, whichever the number of options is. And then remaining 3, read them, put them appropriately. Do one final read through, and then move on. That's pretty much it. Now, don't make any assumptions in the ranking questions. Each answer has to be treated. So read an option and don't, assume, okay, this means this. Read it as it is, and then, every answer has to be treated as an independent, discrete action. It only has to be considered as what is written. Don't assume or add anything mentally to what is specifically stated in these options given. Again, domains, professional integrity, empathy and sensitivity, coping with pressure. You have to keep all of these at the forefront. Now, a lot of times you will have ranking questions where you will have colleagues making a poor decision, or so in these situations, don't be the person making the decision for your colleague. You have to empower your colleague first. So whatever a situation concerns against, the most important action will be to empower that person to make a particular. So you don't go behind people's back, really. If a colleague is doing something bad, you don't report to the supervisor yourself directly. You don't, what do you call it, report to a nursing supervisor or their educational supervisor directly. You go, you talk to the colleague about it, and you empower them to make the right choice for you. Now, you have to think about everyone. Like I said, You have to basically cater to every character in the vignette. So if it's an unethical request from a relative, you discuss it with that particular person. So let's say if it's a daughter that wants you to break confidentiality for a patient that's being diagnosed with something malignant, in your immediate instinct would be, oh, I have to protect patient confidentiality first. Now that will come in as the second or third option, but immediately, generally, the first option will be, okay, you know what? Even in the face of an unethical request, this is a person that is important, and this, remember the people thing I told you about. This is one of the people that needs to be catered to, the only option. So really, options like exploring a relative's concern or exploring the patient concern or talking to the patient and talking, delving deep into what they're thinking about. These are important. You do not dismiss the patients or their relatives in any of the options. And if any option specifies that or implies that, that will rank lower down. So like I said, if a patient-centered response may sound appropriate, but if it fails to address a patient relative's concern, the issue remains unresolved. So you know what? That ranks lower down. You have to take responsibility for patient safety. So if you make a mistake, you take it responsibility immediately. And any option that talks about, okay, you know what, like you go and apologize to the patient, or you immediately rectify that mistake in any of the options, you have to do that immediately. And any option which basically aims to covering up, like modifying records retrospectively or deleting records, that will generally rank as the lowest option. So you have to, if you end up making a mistake, you have to take responsibility for it. Now, you will probably remember ICE from all of you who've taken Lab 2, ideas, concerns, and expectations. I think I've hinted on that in earlier as well, but any option really where you are exploring a patient's ideas or a relative's ideas to find out more option. And this STEM will generally start with, okay, you know what, ask the daughter this, or ask Mr. X this, uh, or these will generally rank highly. So any ideas that they have, any concerns that they have, uh, these rank higher than simply, being dismissive and being like, you know what, explaining, you just go and explain this to them. Because even though that is expressing the issue, exploring concerns is more empathetic than explaining. So asking before explaining generally comes up because of this reason specified. Now, you have to discuss concerns directly with the people involved. If a colleague is making an error, you address the issue directly with the colleague first. And then these answers usually rank above answers where you're discussing that concern with a senior, whether that's a registrar or whether there's their educational supervisor or whether that's a consultant. Why? Because it helps maintain the patient's trust while ensuring that this issue is dealt with. And you never pass the buck. So answer with where you're simply passing the responsibility to a colleague. So, if it's a patient safety scenario, you'll be like, okay, you know what, tell XYZ colleague to resolve this, or tell the nursing colleague to resolve this. You do not do that. You don't pass the buck. If something is coming up, any option where you're tackling the issue head on yourself will always rank higher than options where, you're just passing the responsibility to somebody else. And then again, never ever break confidentiality, compromise in patient safety, be dishonest, ignore concerns, act outside your competence. So let's say if your consultant is asking you to do a specific procedure and you don't know how to do it, options where you tell the consultant that you don't know how to do it, or you tell somebody, another competent colleague, to do it, and you observe and learn, will rank higher than, options where you're like, okay, you know what, I'm just going to watch a YouTube video, just read about it and then do it. Those will rank lower. So never act outside your competence. And guys, remember, this is an important tip for this exam. And there's just a, what do you call it? And we're going to go to the buzz. Can you guys hear me? Can you guys see the screen? Can somebody just unmute and just give me a thumbs up or just say yes? And I'm gonna.
Yes, doctor. Yes, doctor. We can see the screen.
All right, perfect. Thank you, Sachin. All right, so like I said, I think this is where we were. Never break confidentiality, be dishonest, compromise on patient safety. If any option in the ranking question implies these, it is usually the least appropriate action. All right, buzzwords, and then we're going to go to the tips for the MCQs, followed by a couple of practice questions for each, just to give you an idea of how to put these tips into practice. Then we'll call it a night. All right, so buzzwords. When you go into the practice papers, you have to keep an eye out for the buzzwords which will tend to, so other than what really the entirety of the options implies. A lot of times the actions seem very similar, or you find it hard to choose between two options. And in those particular situations, it is the buzzwords that are going to help you pick between the options and rank one option higher or the other option lower. So good buzzwords are things like we've talked about earlier. So any option that's asks or then explores, and then followed by explains or then offers to. These are good buzzwords. But bad buzzwords, any buzzword where you're insisting to do something or demanding or telling somebody to do something else or just dismissing somebody or ignoring somebody or anything that really implies dishonesty in your actions, those are bad options. Now coming to the MCQ portion of the exam. So we talked about the tips for the first portion, which is the ranking question. The multiple choice questions, as with the ranking questions, they begin with a STEM, your F2 in a foundation program, and it'll give you an obstacle or an issue. But here you will be given around 8 options, and you have to choose the 3 most appropriate options to take in this action. So there'll be a list of 8 options that you just, instead of in ranking, you have to drag and drop. Here you just, there'll be a checkbox next to each, and so whichever 3 actions you think are correct, you just select them and you're good to go. Now you will be asked. Now here's where the key difference lies. So the buzzword for the ranking questions was or. The buzzword for the multiple choice questions or the MCQs is the word and. So you will be asked to select the 3 most appropriate actions, which, when taken in combination, most comprehensively resolve the issue with the scenario. So the same way, where you're going to read a question, you're going to identify the people involved in the question stem. You're going to identify the issues that are involved in the STEM. And then you're going to, but here in the ranking, you were, each option was an independent discrete action, and the buzzword was or. Okay, I'll do this. If I can't do this, then I'll do this, so that, or this, or this. Here, you have to choose the 3 options that resolve the issues completely for everyone, but combined. So you will say, okay, I will do this and this and this, and this is what is going to resolve all of the issues for all of the people. And the best way to determine that is, once you've picked the 3 options, you rehash the people and the issues identified, and then you read the 3 options in combination. You're like, okay, if I do this and this and this, does it resolve every issue for everybody? If it does, and in a way where all of the the core competencies are taken care of, where professional integrity, coping with pressure, empathy, and sensitivity, okay, fine, these are the 3 correct options, I move on. So every correct option gives you a score of 4, and every incorrect option gives you a score of 0. So depending, really, you could get a score of 0 if you've chosen none of the correct options, which is highly unlikely. 4 if you get 1 correct option, 8 if you get 2 correct options, and 12 if you get 3 correct options. So basically, the scoring is kind of simple for the MCQs. So again, when you're practicing questions, make sure that even with the MCQs, you read the rationale, because that will help you identify the logic, identify the good and the bad buzzwords, and understand. You will over time develop an understanding of these rules. So you're going to identify situations and extrapolate the logic given in one situation to new situations. And over time, you will notice that once you develop a hang for the logic used in particular situations, and you're using them and you're answering questions based on the issues and people identified logic that I've told you about, you're able to identify the good and bad buzzwords, you're able to do really well, and you will see your score improve as you practice more and more. Again, the MCQ top tips, they're very similar, so I'm just going to brush over these very quickly before we do the practice questions, and then I'll answer your questions, and then we call it a day. Number 1, ideas, concerns, and expectations. Any options where you're talking to a patient or a colleague, asking them what's going on, why they're concerned, discussing an issue, that is a good option. Select that. Any option where you recognize the problem that's mentioned in the STEM and you're offering that. So let's say if there's a patient who's dissatisfied with their care they're given, and so an option tells you, okay, you know what, if you can ask the patient if they want to speak to a more senior doctor, that is a good option. So suggesting that they contact, so any problem that is identified and any option that helps resolve that problem for the patient or for the colleague. So for instance, the patient contacting the GP out of hours because they're at home and they've called you, that could be one potential option. So again, if there are reasons that you're unable to directly help patients in a situation, then you do indirect responsibility taken with actions such as, let's say none of the options allows you to resolve the issue yourself. So in that particular situation, you find somebody else. So, or you point the patient in the right direction to be able to resolve that situation. Empathy and sensitivity, again, you have to acknowledge the patient's feelings. So if a patient is angry, for instance, or if a patient feels belittled by a colleague or yourself, for instance, you tell them that you're sorry, you apologize, or if you've made a mistake, you apologize to the patient. You have to prioritize patient safety. So at any point, so let's say if a patient has been prescribed a drug that is, what do you call it, that they're allergic to, that you realize later for whatever reason, or if a patient's care has been compromised in any way, for instance, you reviewed the wrong reports or the wrong x-rays and you prescribe something and you realize that action has taken, you immediately, what do you call it, rectify so one of the options that whatever rectifies that situation. So if it's deleting the previous order or replacing that order with a new order, where new medication order, and so in this way, particularly deleting the order doesn't mean that you're trying to cover up for a mistake. You're basically rectifying the situation. You'll realize what I mean when you start reading the options. So, or if a colleague's action is putting patient safety at risk, you ensure you talk to them directly and explain your concerns. So, for instance, if a colleague is overworked or is going through an emotional breakdown for whatever reason, you talk to them, but then you also make sure that you're resolving the patient safety issue, resolving some that colleague's issue in the options that are given. You recognize your limits, so never act outside your scope of practice or beyond the limits. So remember, guys, at every time, you're not just answering these questions as a doctor, you're answering these questions as a foundation year 2 doctor. Okay, so there will be sometimes options where options will be given which will be appropriate for a consultant to do or even for a senior colleague to do, but are beyond your scope as a foundation year 2 doctor. So a lot of times, let's say you will be told, okay, you know what, like XYZ doctor wants you, the time's running short, a surgery is scheduled, and they've told you to do consent about a patient, and you don't know about the procedure enough. You never go and consent somebody like that unless you know particularly what the risks and benefits of the procedure are, and you're able to explain it to the patient. Or if you're told to do something like a practical procedure, for instance, a lumbar puncture, and you've never done it before, you never do it, despite, because anything where you're doing something out of your scope of practice or competence, you immediately back out from that. Now, but you also have to be a supportive colleague. So, actions which are supportive of colleagues are usually one of the three appropriate responses. Offering to discuss an issue with a colleague. So if a colleague is having whatever issue, something at home which is affecting their work, there will be things like, okay, you know what, make coffee for your colleague. That actually ranks as a supportive. It might not sound like an appropriate action because you're delaying work, but in that particular situation, one of the people affected is your colleague, and them being emotionally affected and not being able to give the patient care that they're supposed to basically affects patient safety as well. So, asking them to take a break for 5 minutes or making them a cup of coffee and calming them down will rank as an appropriate action. Again, your target domains: empathy and sensitivity, professional integrity, coping with pressure. Seeking from advice from seniors is often a correct response because so in a situation where you're confronted with something that you don't know how to do, telling your registrar or telling the consultant is generally one of the appropriate options. So escalating to a colleague doesn't signify incompetence. Escalating to a colleague where you've identified a limit in your competence actually is the right thing to do for the exam in real life as well. And then duty of candor, which basically says that if any of the options mentioned, a mistake has been made and a patient is inadvertently affected, choose the response which informs the patient or which offers an apology to them. Speak directly to the individuals concerned. Avoid delays. So there will be questions where you'll be given options. Okay, you know what, you did something, or you were supposed to do a handover but you forgot, or you were supposed to hand over a particular task to somebody and you forgot and you reached back home. Options where you're resolving that situation the next day, or review in the next clinic, or at the next teaching session, they generally rank lower. Or in the MCQs, for instance, they're not selected. Why? Because delaying time will compromise patient care, so you never really do that. And then taking responsibility So, for instance, if there's an action which inappropriately passes the responsibility to a colleague before even trying to resolve the issue yourself, usually an inappropriate, for instance, like I said, telling somebody else to do something or asking a nurse to do something else. All right, guys, any questions so far? I would ideally, because I don't want to switch between the two modes because I'm really unsure about Zoom. So if you have a question, just unmute your mic and go ahead. If not, let's just do a couple of practice questions for each. And I'll just, last slide will be about the resources and then we'll call it a day. Let me just see the chat real quick. You can actually, there you go. You can type it out as well if you have a question. Any questions so far? All right, perfect. All right, so let's just dive into the practice questions. Has this session been helpful at all? I'm hoping, with these tips, and I'll share the slide and the session on a YouTube video as well. So, if you're able to review these slides again, especially when you're doing a more, what do you call it, back-to-back practice of the questions, you will, what do you call it, you will hopefully have an easier time tackling these questions rather than, just delving straight in without knowing what really you're supposed to be doing in these each of these domains. All right, so practice questions. Number one, now for the practice questions, let me see. Oh, did not mean to go back. Let me just do that. All right, so for the practice questions, here's the deal. The way we're going to do the practice questions is I'm going to show you guys a question and I would like you guys to take a crack at it. Now, remember, when you're doing the practice questions, forget everything else. You can review these slides later, you can review the video later on YouTube, but for now, just do this. Read the question, identify the issues, identify the people, and then rank your answers appropriately. And I want you to take a note of, you can comment your options as well if you want, or you can take a note on a piece of pen and paper if you have one handy. And then I will share the correct answer. And since we have a minute and 52 seconds for each question, I'm going to give you guys that time. In fact, let me just set up a timer for that so that I have, what do you call it? Let me just one sec. I've got my stopwatch ready. So I'm gonna give you guys a minute and 50 seconds. Let's just keep it at that. For each question, there's really just 4 questions. So I'll show you guys a question. I'll give you guys a minute and 50 seconds. Read through the question, read through the options, use the logic that I've told you, put down your options, and then in the next slide, I'll tell you what the right answer is and what the rationale for that right answer is. We're gonna do this for each of these 4 questions. All right, are you guys ready?
Yes.
All right, perfect. All right, so let's just start with the ranking question. Ranking question, you have to remember, rank them in order of appropriateness. 1 most appropriate, 4 least appropriate. This is a question with 4 options, okay? So 1, 2, 3, and go. Can you see? All right, sorry about that. I know it says click to add title. This is just me making the slides in a hurry. Let me read them out in case you are having trouble reading it through that. You're a foundation year 2 doctor working in the Ops and Gynae department. Mrs. Smith, a 63-year-old woman, has been referred by her GP with postmenopausal bleeding. The HCA, which is really the healthcare associate, informs you that 4 of her relatives are on the ward expressing concerns. He reports that the patient's daughter specifically requested that you do not disclose the diagnosis to Ms. Smith if the results are in keeping with endometrial cancer. She states that her mother has already had a very dreadful year and she will not be able to cope. You review the biopsy results, which confirm that Ms. Smith has endometrial carcinoma. So, who are the people here? You have the HCA, you have the patient, you have the daughter, and the main issue is the daughter's concern versus confidentiality of others. So I've done half the job. Read through the 4 options and then note the options down. In fact, I'd really like it if you guys can put your options in the chat as well, and we'll see how close or off you guys were from the actual key. You have about 30 more seconds for this question. Take 40 actually, because we delayed the start a bit while reading the question. 10 more seconds. All right. So let's see. We have one person who's commented. Hopefully everybody else, well, three people ever. BADC, BADC, BADC. Let's see. All right. So the correct options are, where are we? There you go. The correct options are actually B, A, C, and D, not B, A, D, and C. Why? Let's talk about these one by one. So this scenario basically revolves around the importance of empathy and sensitivity, while aligning with the GMC's good medical practice. Now, option B is most suitable because it demonstrates active listening. So, like I said, one of the most important things you have to do is you talk to the daughter, explore her concerns. So, you take her away. Now, the second option respects her autonomy and confidentiality by offering her the choice to involve her family in a conversation, thus honoring the daughter's wishes, while still engaging her in the decision-making process. So, you don't tell her that, you basically let the patient decide whether she would want the family present while discussing her results or not. Now, between C and D, most of you put D above C. Now, the reason why option C is above option D is because it is patient-centered, okay? You are in a while patient-centered in assessing Mrs. Smith's preferences, it disregards the significance of family involvement as per the daughter's request. However, option D is the worst because it disregards the daughter's request completely, and it shows a disregard and lack of empathy towards the family. So, informing the HCA to advise the daughter. Now, you're doing two things wrong here. Number one, you're not confronting this issue directly. You are passing the buck to another colleague, whereas this is an issue where somebody has escalated to you, so you don't throw it back to them to resolve. You resolve it yourself by telling the relatives to resolve. They might not like it, but it's better than asking somebody else to do it. And thirdly, you are, what do you call it? You've done two things wrong in this, and that is why C is better than D or D is worse than C. Number one, you've passed the buck to somebody else, and number two, you have completely disregarded the daughter's concern while passing that buck. Does that make sense? Hopefully, yes. All right. Are you guys ready for the next question? All right. Let me just start the timer. You can start reading. Yeah, this is a plain and simple. And I'm not going to speak while I start the timer. Timer's starting in 3, 2, 1, go. Read the question and the options, and then answer in the comments, and then we'll discuss what the right options are. All right, you guys have exactly 1 minute left. I'm hoping you guys have commented in the, or you are commenting. So 10 seconds left. All right. All right. Time's up. Really, so now you realize that, especially when the question stems, and trust me, these are the smaller stems. Like there will be question stems that are actually longer than this. So by the time you're done reading, identifying the issues, reading through the options, you realize that there's really not much time left. And hence, for the clinical part, you have to aim for perfection, so your knowledge, background knowledge has to be good. But for this part, appropriateness, uh, or being as close to the examiner's key as possible, balanced with time, both of these things are very important. All right, so let's just see the chart and see what options we have. DCEBA and then DCBEA. Well, good thing is you've identified the best and the worst options correctly, Safa and Fatma. But let's see. So the correct options are D, C, B, E, and A. What options do we get in the chat? Fatma, you got them correct actually, and Safa, you weren't too far off either. So let's talk about why these are the correct options for those of you who, what do you call it, didn't uh, get it as correct. Rational. So see, this scenario revolves around managing pressure within an MDT. So there's conflicting priorities. You have the physiotherapist trying to contact a colleague, and the colleague is being rude to them for whatever reason. It could be because they're disturbing him unnecessarily, or because she's stressed out. So building and maintaining positive working relationships with all members of the MDT is crucial. And so option D aligns with these principles by addressing the situation directly with Alex, questioning his response, expressing a desire to provide guidance and peer support. So it implies that the response is unexpected, but as compared to the other options, you're not passing the buck to anybody else. Now, neglecting, here's the thing. There will be options where you will be pressured to do something else in a lot of the questions while you're handling something else. So, for instance, you'll be making a discharge somebody, or you have a lot of things pending, and nurses are piling extra stuff onto you. But any option where you are told to just ignore those requests or calls is generally a bad option. So neglecting work-related calls or failing to complete any particular clinical task is very unprofessional. It can compromise patient care. And so any option C, it shows a willingness from Alex to gather information about their behavior from colleagues before deciding on the most appropriate course of action is okay. Option B indicates sensitivity by sharing concern with someone in a mentoring role, which is the educational supervisor. Option E is similar to option B, but involves others who are not in a mentoring role, transferring the responsibility. So in this case, option B was, what do you call it? Sorry, option E was asking one of the other F2 colleagues on to talk to. Education supervisors generally are a better person to report to. So, talking to other colleagues who are the same level in a lot of those questions will amount to gossip. So, be careful about these options. Very rarely are they correct where somebody is doing something and you're talking to a colleague who's working at the same level, so F2 level, about it, about that issue. Generally, that is not the case. So, after you've gone through talking to them directly, if the remaining options are talking to somebody else, it will generally be the registrar or their educational supervisor or the consultant. So option A is considered the least appropriate as indirectly supports Alex's behavior by acknowledging that the repeated beliefs from the physiotherapist, while overlooking Alex's conduct towards them. So I think you guys picked the worst and the best correctly, and in between doesn't really matter too much. You will, what do you call it? You, at most lose a mark if you've, or two if you've shuffled inappropriately between the two. But really, I think this practice demonstrates why. So you've seen, what are the issues arising? What are the people involved? So let's say if somebody were to choose an option based only on what Alex did, while disregarding what he was, what do you call it? If disregarding the physiotherapist priority, then that's bad. So, what is the option that resolves all of these correctly? You talk to Alex to explore his concern, while also empathize, and that will bring up the issue while you're not disparaging what the physiotherapists are doing. All right, so MCQs next. I'll give you guys the same time, similar question. Because there's 8 options, the font is a little smaller. I'm hoping you're able to read through the question. I will still just read through it in case you think it's too small. In fact, let's just do this for the MCQs. Let me just put this in full screen for these two questions. There you go. I think they'll make it easier for you guys. All right, time starts now. So pick three options that you think are correct. You can put them in the comments. Sorry, there you go. We have roughly 30 seconds left now. All right, time's up. Let's see. So your F2 on the hematology rotation, recently you've been experiencing severe migraines and your GP has prescribed somatriptan to be used when experiencing an attack, but it causes, although effective, it causes drowsiness and you've noticed it affects your concentration at work. So, and you're worried that this could lead to mistakes. What are the three most appropriate actions to take in this situation? Let's see the options. Everybody has done C, D, and G, C, D, and G, C, D, and G. You guys were correct. It is C, D, and G. So you arrange a meeting with the hematology consultant to explain your situation. You arrange an appointment with your GP to discuss the side effects, and you arrange a meeting with your educational supervisor for further, what do you call it, advice. Why these? Just work out what rationale. So this highlights the importance of self-awareness and professionalism. So, given the drowsiness, it could compromise patient safety. So you have to discuss this with your GP so that he can possibly give you an alternative. Number one, you have to discuss it with the ward consultant, which was option C, the hematology consultant, because it's important to let him know that, you have this issue going on. And then arranging a meeting with your educational supervisor is crucial because this is a healthcare issue that is likely to be ongoing. So they can probably give you guidance and support to better manage your health and professional responsibilities better. So it basically covers all three of domains. It covers the issues at the ward through the consultant, through talking to the consultant, gives you a short-term, what do you call it, measure by talking to your GP, and gives you long-term support for your issue by talking to your educational supervisor. And that is really the key that was in this. So last question, guys, and I think we've got like 8 minutes left in the meeting anyway, so I'm gonna wrap it up before that ends. There you go. So start the timer. You got 1 minute left. Roughly 10 seconds now. And time's up. All right, let's check your answers real quick before we dive in. Everybody's picked D8C, CD8, CD8. There you go. You guys are correct. This is, I'll just go back in. C, D, and H. You explain your mistake to the consultant. You inform the patient about the prescription error, and you resolve that error. So, you've made a mistake. You own it up to the consultant. You own it up to the patient, and you own it up to the, and you rectify that mistake by giving the correct treatment. Now, guys, I don't think I'm going to delve into the rationale too much because I think it was pretty obvious that why the correct options were. But reflecting on your portfolio, consulting microbiology, a lot of these other options were redundant or completely superfluous because you have to identify the issues and the patient and just talk about these things that benefit in the long run, like learning from your mistake by documenting in the e-portfolio, or superfluous things like consulting microbiology. These generally are not the incorrect option. So issues currently at hand, people involved, and the answers that resolve those issues, really, that's the key. All right, last things, and then you guys can we'll do a quick question session before I call it a night. The resources that I use to prepare. Again, guys, excuse me, I don't claim to be perfect for the professional dilemmas portion. Why? Because I had a 243 the first time, or 241. And I realized, I think this time around, it was because I focused on the clinical portion too much. But I think that ended up really compensating for me as well. That said, I wouldn't recommend that, I would say give equal time and importance in your preparation to both. So for the professional dilemmas part, go read the GMC Good Medical Practice first, then go through your Oxford Assess and Progress. That has more than 250 questions. It has mocks in the end as well. So doing the entire book will take you guys a few days. Number three, once you're done with both of these, and you feel like you've developed a good enough logic of what to do in particular situations, there's around 250 practice questions for revised MSRA. Actually, these two questions were taken for these 4 questions were taken from revised MSRA as well. If you needed this discount code for the subscription, you can use my discount code Dr. Zohaib 10. And then after all of these, towards the end, you should be doing the UK Foundation Program Organization past papers, which are really targeted for the UK graduates. But again, the same logic applies in those papers that it does in the MSRA as well. That's it, guys. If you have any questions, there's really 3 minutes left to this meeting. You can type them out, or you can really unmute them and unmute yourself and ask your question. I will be happy to reply. When the meeting ends, we can switch over to answering the questions or answers in the WhatsApp group chat as well. I will be sharing the GMC Good Medical Practice as well as the Oxford book and the UK FPO past papers, and I'll share a link to the Google Drive that has other resources as well. Now, the issue with doing too many resources is, and these are the resources I've done personally, so I can vouch for them because their logic really, for the Oxford book, Revise, and UK FPO, the logic aligns. I know there are other resources like Past Medicine, MCQ Bank, eMedica, but I think these should get you covered. And if you do too many resources, you are right, there is conflicting logic, and you might just end up confusing yourself even more. So again, the decision has to be yours, but my recommendation would be to stick to these resources. And these should be enough to prepare you adequately. All right, let me just see the question that we have. Fatma has said, great session. Thank you, Fatma. I hope this has helped. Really, the whole point of doing these sessions is because, I read somewhere some time ago that, if you want more of something in life, start by giving it to other people. And I feel like I have been very lucky and fortunate to come across these resources that, especially Revise MSRA, that most people, it's not Revisa, sorry, that's a typo, it's REVISE, that most people don't use, and most people do recommend MCQ Bank and Past Medicine. My opinion and experience was very different, and hence I was like, let me just get the word out in a way which benefits other people, just like I benefited as well. So hopefully, these sessions have been helpful. I am going to be posting a recorded session of this on YouTube, and and I'll share the link when it's ready in the group chat as well. You're welcome, Safa. Thank you so much, guys. We've got the last minute or so I'm gonna just start wrapping things up a bit. I hope this is the first time I'm trying to do a mentorship thing like this for other people. I will continue to be active in the group. Bear in mind though that I do work 8 to 2. What do you call it? In the morning, so Monday to Saturday, and then in the evenings I'm dealing with all the paperwork. So hopefully we'll be going to Leeds. I'm now currently so after the upgrade offer, I'm now working on the certificate of sponsorship paperwork. I've applied for a passport for my wife and son, and this is the paperwork that I've been dealing with, and that's why I've been a little inactive. That said, once you guys get your practice started, if you have any questions, post them, and the moment I get an opportunity, I will definitely get back to you. Sachin, you saying I sure should forget it? That's a good thing, Sachin, and that's the attitude you guys should definitely carry for this exam and really for life as well. What goes around comes around. All right, guys, before the session ends, I'm going to call it a night. I hope you guys have a good evening or night. Get cracking. Now is the time to start preparing, and by next month, start working on the clinical portion as well. All right, I hope you guys have a good night. All right, take care. Bye bye.